Hour, sponsored by the Advanced Cosmetic Surgery and Laser Center.
In Look Good on your lunch hour today, the doctor becomes the patient. Dr. Jon Mendelsohn of the Advanced Cosmetic Surgery and Laser Center just had an eyelid procedure performed. He usually does these procedures himself. He joins us now. We'll take a look at how he's healing. How are you, and who did you have do your procedure?
Hi, Liz. I had an upper blepharoplasty, an eyelid surgery. We've talked about it before. One of the best procedures I think people can have to look more rejuvenated. There was a doctor who was a fellow earlier back in the 90s that I worked with. And so I texted him when my team told me I was starting to look a little bit tired. And he was right here ready to go. So we did this on Saturday. So I'm day 4.
So tell me a little bit, we have some video. What is the procedure? What do you actually have to do?
Yeah, so the actual procedure obviously is addressing hooding or extra eyelid tissue. You can see there my extra eyelid skin. Scott is marking very carefully the natural crease in my eyelid and measuring the extra skin that you can see between the calipers there. Next thing, you localize it, which means you simply numb it up, tiny little injection, lidocaine and epinephrine. The epinephrine helps it not to bleed. The procedure probably took him under 20 minutes. And we remove skin, perhaps a little bit of extra tissue, a little fat. And then you can see there that he's suturing. That's the last suture he's placing. It goes back and forth underneath the skin, and it stays there for a week. So I still have those sutures in. You can see a little bit of bruising. There's some swelling. What you're supposed to do following this is go home and ice and relax, which I did. But because he hasn't been back in town since the 90s, OTR has changed a little bit, and he's a big bourbon drinker, so I had to take him on a little tour of the city. But anyway, you know, I was functional right away. You can see with what you're showing there, the incision line. You can't really see the sutures because there's one by my nose, and there is one out here temporally. I'm going to take my glasses off. I know we don't have really a zoom, but I'm going to close my eyes anyway. So there's a suture towards my nose, goes back and forth underneath the skin, and a little tiny piece hangs out here. I've been operating and working all week. My patients are getting a kick out of it. But I have been talking about doing this for almost 20 years. Last October, as you might recall, Hope did a laser under my eyelid. And what happens, just like all of our patients, is you start looking in the mirror. And I started noticing my eyelid, the hooding I had even more. And anyway, so I'm thrilled so far.
So wait, I want to just interrupt you, because I think this is the popular guy procedure, isn't it? Did you tell me a lot of guys get this done?
Yeah, absolutely. This is probably the #1 male procedure. I mean, men probably represent 18%, and women are probably 82% of what we're seeing. But of the procedures, upper blepharoplasty is absolutely a top procedure.
All right, let me show people. We have some before and afters of yours just in these days, and let's make sure that they know how to find you. I know that it's just a few days out, and we are going to follow up for sure to be able to show final results. 513-351-3223 is your number. Those final results you expect in when?
Well, I tell patients every day, every week, every month, they continue to improve. I mean, I'm look okay now, a little bit feminine maybe with my eyelid showing, but over the course of the next week, I mean, it should look quite good, and even months out from now, it looks even better. All
right, Dr. Jon Mendelsohn, thanks for sharing your journey with us. It's very interesting, and we do want to remind people this usually costs you in the range of about $5,000, not covered by your medical insurance unless it's for medical purposes. Thanks, Jon.
Thank you, Liz. Nice to see you.
All right, we got some great